Hello everyone, welcome to my channel Ravi Study Physio. So on this series of medical physiotherapy laws and ethics, so the next topic is medical diagnosis versus physiotherapy diagnosis. So how the medical or like doctor's diagnosis which is different from physiotherapy diagnosis, and what treatment will occur in physiotherapy and in the medical diagnosis. So let's understand about that and how you can write in university examination. Also you can read about that. So the diagnosis is the essential first step of determining the path of recovery, distinct but interrelated. While medical and physiotherapy diagnosis differ in focus, they are two sides of the same chain. So diagnosis is the first step for a treatment procedure, either if their doctor is to diagnose or other physiotherapist to be diagnosed, which is interrelated with each other because they have to be rehab and back to their normal life as a doctor, as a physiotherapy towards the patient. Four have two sides but have same action or a same chain and focus from a single goal to rehab the patient. So introduction, the role of diagnosis, the process of determining which disease or condition explain a person's symptoms and sign. So both medical and physiotherapy diagnosis have determining the disease and condition and pathophysiology about that. Focus on identifying the underlying pathology or cellular structural damage. Both have to be understand what is the pathophysiology, what is the particular bacterial or viral disease, and also the structure of the particular disorder, and also the damage how much occur in the patient. So both have them have to be stream work in this patient diagnosis. Aim at classify the biological cause of illness. So both have same procedure to classify the what is the cause of the illness or particular procedure of the diagnostic treatment for the particular disorder. So let's differentiate about the medical diagnosis versus physiotherapy diagnosis. So first is medical diagnosis. It focus disease, pathology and etiology. So it basically focus what is the disease, what is the pathology, and what is the etiology. It means the cause. Second one is authorized professional, medical doctor and specialist who have been recommended, have to be specialized in MD in doctorate and MBBS in PG and UG. After that have to be a specialist for the particularly diagnosis for particular disease. Primary tools, patient history, physical exam. That the first tool is to be patient history and physical examination to determine the particular disease. Lab, investigation, blood work, biopsy, imaging, X-ray, MRI, CT and ultrasound. These are the approach to determine the particular doctor who have to be what exactly happened in the body, either into the blood vessels, either into the cells, either into the particular organ or into the bone. Purpose to determine the medical or surgical management plan. So these therapeutic these condition based diagnosis approach help to determine the doctor to either it to be managed by the pharmacological or either it to be help to the surgical procedure. Example, a neurological cerebrovascular accident, degenerative osteoarthritis for knee. If patient have neurological condition which is cerebrovascular accident, so on that time the surgery have to be needed. Degenerative changes in the chronic case, the osteoarthritis of the knee, also the surgery of the total knee replacement or partial knee replacement, either condition based of the therapeutic approach towards the doctor. Spinal lumbar disc prolapse or cervical spondylosis. These two conditions have to occur into the chronic condition. It will be treated by the doctor. Either if they come to the acute stage, they will treated by the physiotherapy doctor. Traumatic fracture shaft on a femur. So the fracture will be occur into different joint or different structure and in the shaft to the particular bone. So they have to should go into the medical diagnosis for the doctor. Do not have to be treated by the physiotherapy diagnostic. Next is to be what is the physiotherapy diagnosis. A clinical judgment based on the impact of the condition on the patient movement, function and quality of life. So physiotherapy have primary role to reduce the patient pain for functional rehabilitation, go to the back normal daily activity, perform better ergonomics, perform better gait pattern or also the movement pattern, also the posture and quality of life, also the nutrition guidance. Next is to be focuses on movement dysfunction and functional impairment. Any kind of after the amputation they will help you how to treat the gait balance and coordination. If either into the neuro patient have to be the spinal cord surgery, so after that help will treat the particular function and rehabilitation. Posture and observation like range of motion, manual muscle testing, gait and balance analysis. So these are some major assessment plan for the assessment of the particular range of motion of particular joint, and manual muscle testing the strength of the particular muscle is to be occur on like appropriate or not, gait proper walking pattern is to happen or not, balance is to be there or not in the old age patient and neurological condition patient, identifies how the pathological limits the patient physical capabilities. If patient have a like low strength, so they have introduced about the strength and the enhance the capability to perform their normal life pattern. Next is to be example of the physiotherapy diagnosis to be reduced range of motion with associate pain, muscle weakness and recruitment imbalance, impaired balance and altered gait cycle, limitation of ADLS and postural deviation. So if there is any kind of condition, you have to be must with any kind of consultation of the doctor, you can reach out to the physical therapist or directly into the physiotherapy. There is any kind of weakness of the muscle, there is any kind of balance impairment, there is a abnormality in posture, there is a pain in back on cervical and radiculopathies, limitation of daily activities, do not perform any kind of home activities or also the work professionalities. So the comparison table for differentiate the medical diagnosis and physiotherapy diagnosis. Focus: the medical diagnosis is to be focused in disease and pathology, while physiotherapy diagnosis is to be movement and function. Next feature is to be provider. Medical diagnosis provided by doctor and physician, and physiotherapy diagnosis provider is to be physiotherapist. Feature is to be based on medical diagnosis based on investigations and labs, while physiotherapy diagnosis is based on physical assessment, is to be assessed by the physical therapist. Treatment: medical diagnosis is treatment by drugs and surgery, while physiotherapy diagnosis treatment procedure by done exercise, manual therapy and electrotherapy and various other substitutes. Goal: medical diagnosis goal is to be cure the pathology, while physiotherapy diagnosis is to goal is restore independence of the particular patient. So that is a medical diagnosis versus physiotherapy diagnosis. You have to be write in university examination for your good marks. Thank you.